Bismillahirrahmanirrahim. I am Tanvir Ahmed. Now I am presenting about this topic. Coronavirus, a term of very fearful and concerning subject to the people of all over the world. We know that there is no effective and appropriate treatment option is available, still now available of this virus. At this time, a newly approved treatment option that has the history of success and has raised the hope to the people of all over the world is convalescent plasma therapy. Convalescent plasma therapy is also known as passive antibody therapy. Now, what is convalescent? Convalescent means anybody who is recently recovered from any disease. Now plasma, we know that plasma is a portion of blood. It is a supernatant portion of blood that contain the antibodies that are protein in nature, and these antibodies are act against antigen. Now what is antigen? We know that antigen is a parts of pathogen or any kinds of invaders or foreign particles. Now, what is convalescent plasma therapy? Convalescent plasma therapy means the transfusing of some component of blood extracting from a person who is recently recovered from a disease to the patient who have the same kind of disease. Now, how convalescent plasma therapy act, how it is act, to understand this theme, I am giving an example. For example, assume that I am COVID-19 affected person. As I am already affected by COVID-19, my body's immune system will produce a response against this virus. As the protection measure, my immune system will produces antibody. My immune system firstly produces immunoglobulin M, and some days later it produces immunoglobulin G. These immunoglobulin M and immunoglobulin G, these two types of antibody will fight against coronavirus, and finally it has these antibodies has the ability to kill the coronavirus, and if they do so, I will recover from coronavirus. For example, I am recovered from coronavirus. As I am recently recovered from coronavirus, my immune system or my plasma is rich of immunoglobulin M and immunoglobulin G, as these two types of antibodies has recently developed in my body. Now, if a person, for example, my father is corona affected person, as he is elderly person, or if he has severe symptom, his immune system may not have the capability to produce enough antibodies, that means immunoglobulin M and immunoglobulin G, to fight off against coronavirus. At this time, at these cases, I can donate my plasma to my father. Now I am donor and my father is recipient. Now from my blood, my plasma is extracting, and this plasma is donating. This plasma is transfusing to my father's blood. As a result, my father's immune system will be stronger than the previous time by getting these two types of antibodies, and now his immune system has acquired the capability to fight off against coronavirus, and in this way convalescent plasma therapy act. Before donation, some criteria should be maintained. The structure of the antibody or the types of the antibody of the donor and recipient should be checked. Now the person who donating the plasma to the sickest person, some criteria must be maintained. That means who can donate plasma. The person who will donating plasma, he must be at least 70 years old and good weight. He must be good health and feeling oil. he had a prior diagnosis of COVID-19 and meet all the specific laboratory criteria. He must be free from all kinds of symptoms of COVID-19 prior to 14 days of the donation. These criteria must be maintained. And one of the important information should be mentioned that we cannot treated so many person from a donor's plasma. We can only treat two sickest person from one donor's plasma. So how many convulsant patient we will get? So many patient will be treated under this therapy or treatment option. That treatment option still now not available and not become very often. The FDA has approved this treatment option for clinical trials as some success history has already found. That's why at first it was approved, it was trialed in USA as some history of success has already observed. Now this treatment option or this therapy is trialed or practiced all over all the parts of the world. Thus that ends my presentation about the convulsant plasma therapy. Thanks to all. Thanks.